for the month of July. This month we're covering HPV vaccination and cancer prevention. So we're really glad that you could join us today. And we have a special presenter, Dr. Arvind Bakhru is here from Arizona Center for Cancer Care. And he's going to be sharing with you guys a little bit of information about what HPV is and how HPV vaccination can help prevent certain types of cancer. So we'll go through his presentation, and then at the end we'll have a little extra time for a Q&A if you guys have any questions. Also, if you do have questions during the presentation, feel free to type those in the chat box if you're joining us via Zoom, or if you're joining us via Facebook Live, you can type in your questions there as well, and then we'll read through those questions once we get to the end of the presentation and into that Q&A session. So without further ado, I'm going to turn it over to Dr. Bakhru for his presentation. Thank you so much for joining us today.
Thank you so much. This is Dr. Bakhru. I am a gynecologic oncologist with Arizona Center for Cancer Care and Virginia Piper's Cancer Network. We're going to just talk about the HPV vaccine, and I'm going to just pull up some slides here, and we're going to talk about those, and then we will go to some questions. Okay, so I'm just going to switch over here, and what we're going to talk about are 10 things that you should know about HPV, and maybe some of this is old news, and some of this hopefully will be new to many of you, and should provide some good information for us going forward. So 10 things to know about HPV. So the first thing, we're going to list all 10, and then we're going to go through these a little bit more, is that HPV infection is common. It can cause cancer. Right now we've been talking a lot about the coronavirus. HPV is the human papilloma virus, and it's a different kind of virus. And we know that just like with the coronavirus, preventing is better than treating it. So with HPV, we want to prevent cancer rather than treat it. And the HPV vaccine is cancer prevention. And so that is, we're going to talk a little bit more about the vaccine. The HPV vaccine also works. It's highly efficacious. We'll talk about the safety data on it. We know that it's very safe. We've learned a lot about it over many years and thousands of women taking it. The HPV vaccine is given in general with the other preteen vaccines. And we'll talk about the ages as well. We know that it's best around age 11 or 12. New guidance is that the preteens really only need 2 doses of the HPV vaccine. So most parents do choose to vaccinate, and you know, we'll talk about the benefits over that child's lifetime as we go forward. So let's just talk about how common this is. And you know, I see a lot of women in my office who have HPV cancers, unfortunately. The HPV stands for human papilloma virus, and we know that there's many types of human papilloma virus that can infect the genital areas of males and females, or even the mouth and throat. And many people don't get symptoms from it. In the vast majority of cases, it clears by itself. And it's a virus that your body just fights off. But we know that there are some people who get problems from it. And most people don't know that they had the HPV virus in their body. It's not something that you would normally have symptoms from unless you were told you had an infection from it, or if you developed a cancer or pre-cancer from it. And most HPV infections actually happen during the teen and college age years, so a pretty young age group. We know that HPV infection, human papilloma virus, can cause cancers though. It can cause cervical, vaginal, vulvar cancers in women, penile cancers in men. It can cause anal cancers or mouth and throat cancers and genital warts. So it depends on the strain of the virus, but it can put people at higher risk for cancers. And here is a good table that tells us the number of cancers that are caused by HPV each year. And we can see that obviously women can get cancers of the cervix, vaginal, or vulvar area, and men can get penile cancers. There's a lot of people. And these are all preventable cases, really. And so what we are interested in doing is trying to make sure that people know about the HPV vaccine to prevent all of these cancers. You know, if we were entirely efficacious at preventing it, we could prevent 34,000 or more cancers each year, and that's a huge number. And interestingly, when I was updating this data with the 2019 data, it's actually much higher, these numbers, than the 2015 data. So the numbers aren't headed in the right direction either. So preventing cancer is better than treating it, clearly. You know, I tell my patients with HPV vaccine or HPV associated cancers or precancers that one of the best things we could do is prevent this from getting worse and deal with it before it's a cancer. And it can cause so many different health problems for people. We know that the HPV vaccine is cancer prevention. You know, if you think about how many people could be affected by an HPV-associated cancer each year, it's really about the same number as attend a baseball game. You know, you think about all those people who could be prevented from having to deal with a cancer in their lifetime. And, you know, all those people having additional testing or additional pap smears or additional biopsies and treatment, and potentially avoiding chemotherapy and radiation or hysterectomies in women. So there's a lot of reason to try and prevent HPV-associated cancers. We know that cervical cancer in particular is one that is by and large fully caused by HPV, and it's often in young women, and those women are often unable to then have children of their own, and so it does have an impact on the next generation as well. So I'm going to go forward here to talk about the safety of it. We know that, and the efficacy as well. So we know that HPV vaccination provides safe and effective and long-lasting protection. There have been over 100 million doses distributed, and we know that it's very safe and effective. We have really good data on this. Like all medical products, you know, vaccines can cause side effects. Most of these side effects are things like pain or redness in the arm where the shot was given. You know, I know when my daughter had the HPV vaccine, she said her arm hurt, but it went away, and you know, people get better after that. In general, it's actually very well tolerated. You know, we tell our preteens or teens to sit or lie down when they get the shot and just wait there for 15 minutes afterwards so they don't faint or complain too much about the pain. But they get better from it. And we know that it's going to provide them long-lasting protection. And the FDA has done numerous safety data checks on this vaccine, and it's used all around the world. Go to the next slide here. And this is a pretty whopping high number. You know, in medicine, we see numbers like getting a 5% benefit or a 10% benefit or even a 30% benefit with a lot of our medicines or chemotherapy even, or other treatments. This is a huge number. So the HPV vaccine works extremely well. It was recommended in 2006 as part of the vaccination series. And in the 4 years right after that, the amount of HPV infections in teens decreased by 56%. And we know that it's even higher if we look out longer term. We know that fewer teens are getting genital warts because the HPV vaccine actually covers 2 of the viral strains that cause genital warts. And in countries such as Australia, which have really high uptake of the vaccine, they can even see declines in the number of cancer cases. And that is highly encouraging. There was a study in the Lancet that looked at 65 different articles on the population effect of the HPV vaccine on women and girls, including 60 million people and 8 years of follow-up. And the vaccine program had a huge reduction in HPV-related cancers and genital warts and precancers of the cervix. In fact, the numbers on that are extremely high. Like the reduction in HPV, high-risk HPV infection was down by 83%, genital warts down by 67%, and precancers of the cervix by half. And so we know that we can get really good outcomes from the HPV vaccine. And we know that this protection will last at least 10 years, which is fantastic. So number 4 that we had on there was that HPV vaccine is given with the other preteen vaccines, like meningitis or whooping cough. And why there? Well, I know a lot of people wonder about, like, why do we give it with the preteen vaccines? Well, it happens to be the most efficacious right there. And so that's kind of this next slide here. But boys and girls can actually start at age 9, and you want to try and finish by your 13th birthday. It's approved for ages 9 to 26, and then now recently has an expanded age range. But our goal is to get our preteens and teens vaccinated, and that's because the vaccine actually has a really high efficacy rate at that age group. So if we can build some lifelong immunity right then, before the vaccine or before the virus has affected that person, then we know we can prevent long-term problems. And boys and girls, I should mention, the emphasis on boys as well, can get the HPV vaccine. And part of the reason for this is really to prevent spread to girls. But remember way back at the beginning of the slides that we know that HPV can cause penile cancers in boys and anal cancers and oropharyngeal cancers in the mouth and throat. And, men can get HPV cancers. And in fact, there were 14,000 HPV-associated male cancers last year. And so if we can prevent that from happening to a whole generation of boys, that would be great too. So while we normally think about HPV in girls and how to prevent it for preteens and teen girls, it's just as important on the male side. So yes, if they haven't finished, I forgot about these two on the bottom, but if they have not finished the HPV vaccine series, they should still get it, even after age 13. Like I said, there is an expanded age group now too for high-risk folks, but we really want to make sure that everybody gets their vaccine series. And the other benefit of doing it early for the child is really that you only need 2 doses if you can get it to them earlier. And that's because, like I said, you get a really good immune response. So 2 doses is similar protection to the 3 doses that we used to do if we do it in the preteen group. And then we'll also talk about, like, I think a lot of people wonder, well, is this something that everybody is doing? Just to kind of understand, am I alone in considering this? And as you talk to other parents and school officials about uptake of the HPV vaccine, we actually have good national data to show that most people are now doing the HPV vaccine, which is great. We know that providers are recommending the HPV vaccine, and we're getting near universal agreement on that. And we know that people are getting the HPV vaccine series, which is great. Unfortunately, the United States is not quite caught up to our peer group internationally. You know, we know that, like for instance, Australia and New Zealand and Canada and a lot of the European countries have a much higher rate of the vaccine series than we do. But we really do want everyone to get it, and we're getting there, and then over half of families are choosing to do it. The Healthy People 2020 goal was 80% of nationwide vaccination rate. So I hope that shed some information on how much this HPV virus can affect people, and how much the HPV vaccine can help in preventing future disease in both men and women if we start early and to get our teens and preteens vaccinated in an appropriate way to prevent future cancer or precancer. The current vaccine actually helps with both cancer and precancer and genital warts. So, you know, we have a lot of good information on it. It's been around for many years at this point. And like I said, we have hundreds of millions of doses that have been delivered. So we have good data on the safety and efficacy as well. And so I'll stop there and open it up for questions.
Great, thank you so much. Yeah, that was some really great information. Hopefully that was helpful for everyone. I know anyone who's ever been through a cancer diagnosis or had to watch a family member go through cancer treatment would agree that if there's something that we can be doing that can prevent a cancer from happening altogether, that's going to be the best route for everybody. So hopefully this helps kind of shed a little bit of light that there is a vaccine out there that can help prevent cancer, and give you a little bit of information on how that vaccine works and when that should be given to preteens. So we do have a few questions in the chat box. So I'll read those here for you, Dr. Bakhru. First question, is there a reason why men are getting more oropharyngeal cancers than women?
Well, that's a tough question. I don't know of a reason for why. So to be honest, I don't know. Like, why is it seen more in the male group? You know, I wish I had a good answer for you there. One of the things I would wonder about, and this is pure hypothesis generating, but you know, we know that a lot of the HPV viral strains are worse in smokers, and I don't know if that would be a contributing factor, but you know, I'm a GYN oncologist, and so I don't have very many male patients, unfortunately, so I can't really answer that, but I think that's a great question, and we don't know why, as far as I know.
Great, thank you. And next question, and you kind of covered this in your presentation, but I think it's definitely worth revisiting. Can an older teen receive the vaccine if it was not received at the recommended age of 11 to 12?
Yes, absolutely. And the CDC actually has a catch-up schedule on their website about how to catch up as well. We know that if you're getting it as a preteen, you can get the 2-dose series, and if you're catching up, they have a catch-up schedule on there. We know that we want at least 2 doses 5 months apart, and for the ones that are doing it as a teenager, they're going to need the 3-dose series. But there is good guidance from the CDC about how to do a catch-up, and we do think you need another dose. Like, if you only got 1 as a preteen, you definitely need to do the catch-up. And you can get that after age 13. That's okay. It's better to do it than not to do it.
Great, thank you. And also I can add as well, we can send out some additional information to those of you that have registered for the webinar after we're done, because the American Cancer Society has a lot of information as well as far as the scheduling for the vaccines and kind of a refresher of the information that was in that slideshow for you guys to have, so we can put together some resources for you guys as well. Next question. What is the research in regard to the 3-phase HPV vaccine preventing oropharyngeal cancer?
So, you know, we don't use the HPV vaccine for just one cancer type. So the data is for everything altogether. And so, you know, we're not particularly using the HPV vaccine just to prevent one cancer type. We're using it to prevent multiple cancer types and precancers. So I guess I'm not sure how to answer that question.
Okay. The next question, it says, there is minimal information that both men and women to the age of 45 can get the HPV vaccine. I guess that's not really a question so much as a statement, but maybe you can touch on that a little bit. I know the FDA recently approved the vaccine up to age 45. Currently, the American Cancer Society does not recommend people receiving the vaccine over the age of 26, just because of the lack of data that's currently available around the efficacy of the vaccine at that age. I don't know if you can add anything to that, Dr. Bakhru?
Yeah, you're right. The age indication was expanded, and it is a little bit of a vague indication that it says it's for high-risk groups, but doesn't really specify who is that person. And you're right. So many groups recommended up to the age 26. And I think that's very appropriate, certainly up to age 26. The question is really, you know, who would it benefit after age 26? And I don't think we have great data about who those groups really are. And I certainly get asked about it often in the office about, you know, am I high risk? And I think, like, the bottom line that I would say for most people is that if you have a functioning immune system and haven't had problems from it, then maybe not. But you know, there are people who do have immunocompromised states and may benefit from the HPV vaccine at a higher age group, up to the age 45 indication, or have high-risk behaviors that they need extra protection for, or they've had precancers where it may there may be a good reason to do it, but we really have a lack of data, I think, after the age 26 group. And so, you know, our focus is really on getting our teens and preteens, especially because we know that they get excellent immune responses that can last over a lifetime. And we at least have good data for the first 10 years, and we think that there's long-lasting protection. But yeah, we don't really have a lot of great data after age 26.
Great, thank you. Let's see, next question. Oh, and it looks like you kind of touched on this earlier. It says, are there higher incidence in oropharyngeal cancer from HPV if a patient is also a smoker or chews tobacco, etc.?
Yeah, we know that tobacco puts people at higher risk for oropharyngeal cancers to begin with. And there does seem to be a tobacco relationship with the HPV. You know, one of the things that we all learn in medical school, even with the cervix, and why is cervical cancer related to smoking? Well, we know that there are toxins from, you know, tobacco that accumulate in a woman's cervix. And Could that be part of this whole picture? Well, the same thing may be happening up there. I don't think we have great data to explain the whole pathophysiology, but we know that HPV can cause cancers in the oropharynx, and it may be related to smoking as well.
Great, thank you. Next question. Is there high risk associated with sexual practices as well?
So I think that person might be referring to the after age 26, or
I think so.
yeah. So yeah, like I said, after age 26, we don't really know who is the right group for the vaccine from ages 26 to 45, but high-risk sexual practices certainly could put you into a higher group where it may be beneficial for you. But it's really an individual discussion with your doctor about that, and is it beneficial to you or not. And so it's hard to make a broad sweeping generalization in that group. But we know that exposure or sexual activity can increase the risk of getting HPV. And like I said, most HPV infections are very short-lived and pass on their own. Your body fights it off and it's gone. But it's the ones that persist that cause problems, in any age group. And that's really what we're trying to prevent.
Great, yep, exactly. And then next question, is there a reason that oropharyngeal cancer from HPV has increased so rapidly recently?
Well, I don't think we've known about it for very long in the grand scheme of things. So we really only learned that HPV contributes to oropharyngeal cancers in the last 10 years, and we really didn't have good data on it before that. So that's really why, I think. And it may have been there all along. We just weren't sure about what was the cause.
Great, thank you. That's all the questions that we have in the chat box. I'm not sure if anybody would like to add any additional questions, or if anyone on Zoom would like to come off of mute to ask a question, so you guys can feel free to do that as well. Do we have any questions from Facebook, Marina?
On the ACS Arizona page, we do not have any questions. We just had a shout out from Cindy Stevens saying very informative and helpful. Thank you.
Well, thanks.
Yeah, thank you, Cindy. Glad that it was helpful.
Yeah, I think overall, we want to just remember that HPV, human papilloma virus, is a virus, and it's very common, but what we're trying to do is really prevent the downstream problems that it can cause. And, I would highly encourage anyone to go talk with their physician about whether it's the right thing for them. And especially when it comes to that question of, are we in a high-risk group or not? It becomes incredibly individualized. But we know that it can help prevent cancers and precancers and genital warts, and so there's good reason to consider it, especially given its safety record.
Absolutely, absolutely. Yeah, like I mentioned before, anything that we can do to prevent cancer, this is one of those things that definitely worth learning about and talking to your physician about, because it's something that, given at the right time with your preteens, we know that that's the best time for them to be receiving the vaccine. So if you do have kids that are in that age group or coming up on that age group, or even a few years past that age group, there's that catch-up schedule for them. But definitely make sure that it's a conversation that you have with your primary care physician as to when your child should be receiving those vaccines, because it can help prevent cancer for them later in life. It looks like we've got a couple of other questions that came through. Why did the HPV vaccine get a bad rap in the beginning?
Well, I think anybody who was getting the vaccine in the beginning, there were certain injection side effects that could happen right at the time somebody got the vaccine, such as the redness or pain in the arm that I alluded to. And I think anytime we talk about sex or a vaccine for a sexually transmitted disease, that can make people squeamish. And, I think that it brings out a lot of political considerations, and, people were wondering if people who got the vaccine would be more sexually promiscuous. But there's been so much data and many, many studies showing that's not the case. And it's, kind of unfortunate that it took so long to get adopted in the United States because of that. The rest of the world really got a jump start on the HPV vaccine because we were dealing with that issue. And that's partly why the rest of the world, at least the industrialized world, has such higher vaccination rates than we do here in the United States. We've been a little bit slower just because of those initial concerns, but I think by and large they've all been proven to not be a concern, and it slowed our uptake rate. But I think now that we've had all those studies to show that it is safe, it is efficacious, it doesn't make people have different choices. It's become better adopted, like we showed you on that graph, where more and more people are doing the vaccination, and it's actually more common to do it than not to do it.
Great. Yeah, exactly. I think that's one of the things that you do here is the idea of someone being sexually active, it being a sexually transmitted disease, and you're talking about children ages 9 to 12. I think immediately that gives parents a little bit of an uneasy feeling, which is kind of why we're trying to get the information out there that this is prevention. And so prevention is something that needs to happen long before your child is ever sexually active. So that's why getting it done at that time is the best time for you to be getting it, so that it can prevent HPV infections later in life. So I think that's like you said, Dr. Bakhru, that's kind of the hesitancy that we've seen from parents in the past over the vaccine. But data has shown that it is perfectly safe, and it's very effective when given at the appropriate time.
Yeah, and I would just add, sorry.
No, you're fine.
One of the reasons to do it as a preteen would also be, it's better to get 2 shots than 3.
That too. And I'm sure anyone that has kids knows how difficult it is, with their busy schedules, to get them in to see the doctor. So if you only have to do it twice instead of 3 times, there's a benefit right then and there. So, and a couple of other questions. Are there any, and you did kind of touch on this as well, but kind of a good thing to drive home, are there any negative long-term side effects of the vaccine?
No, I think we have really good safety data over the long term. We've had hundreds of millions of doses, and I think if we were going to be seeing problems from it, we would have seen it by now, because we've had this virus vaccine out for over a decade now, and it's being used both here in the United States and internationally with great success.
Great, awesome. And one of the things too that I always talk about with people that are having questions about the vaccine and side effects, because a lot of people have a misconception that there could be possible side effects when it comes to fertility, which the vaccine hasn't shown any side effects that could lessen fertility. But one thing to think about is cervical cancer, definitely. And you mentioned this earlier in your presentation, that cervical cancer definitely can affect fertility and cause women to not be able to have children in the future. So if anything, the vaccine is helping protect those women's fertility by preventing those HPV infections and preventing cervical cancer. One more question. How might you know if you have HPV? Are there any signs or symptoms that people should be looking for? Should they be getting screened?
Right. In general, there are very few symptoms, if any, that most people are going to pick up on. Certainly in the oropharynx, most people have no symptoms. In the vaginal area, sometimes people will know that they have genital warts, but really it's by exam, and it's by your provider happening to notice that there's something going on, or feeling it, or seeing it, or doing a pap smear. And going to why pap smears are important. That's really the only way that we're going to pick up on the fact that the HPV virus is there and causing trouble. Now, most of the time after an abnormal pap, we're going to just watch it because we know that most of the time it's going to go away on its own. But it does need to get monitored to make sure that it goes away. But there are very few symptoms related to HPV. And if you think about how many millions and millions of people have HPV at any given moment, very few of those people actually know that they had the virus because it was found on an exam or causing a problem.
Great, thank you. I also have a comment here. It looks like one of the people that have joined us on the webinar is a speech therapist, and she just wanted to say that swallowing therapy can be very helpful if there's a radiation treatment for oropharyngeal cancer. And dysphagia, which is difficulty swallowing, is a high percentage of side effects that they'll see with oropharyngeal cancer. And she also has another question as well. Are there any known plans for breaking down the cancer types in the research? I know you had mentioned earlier, Dr. Bakhru, that a lot of the research is for HPV cancers as a whole. So I don't know if you are aware of any research that's currently being done individually on the cancer types.
Well, for the vaccine, we do have data, showing the percentage of reductions for different cancer types after the vaccine is implemented. Like I said, we do have data showing, for instance, that there's at least a 50% reduction in cervical cancer precancers. And we have data like that for a lot of the cancer types, showing that the vaccine improves it. And so we have those specific cancer risk reductions. And it's slightly different in each cancer type, but it's a pretty dramatic difference when you consider how efficacious it is compared to all our other therapies that we do in medicine.
Great, thank you. Any other questions? Oh, it looks like a follow-up to that. Do you know where we can find that breakdown that you mentioned?
Well, all of the articles on that are going to be individual articles, but if you're looking for specific cancer type, where we tend to go is pubmed.gov, and you can look up a cancer type and HPV vaccination, and you'll probably find a whole bunch of articles on any cancer type you're interested in. But PubMed.gov is kind of the central repository for all our medical studies. And so if you went to PubMed, you would be able to type in, say, oropharyngeal cancer, HPV vaccine, and you'll find probably hundreds of studies looking at that. There are many, many studies that are listed there.
Great, thank you. And the next question, can you please speak a little more on how HPV is spread and how contagious the virus is?
Sure. Well, HPV is spread from sexual contact, and that could be orogenital or genital-genital, and it's really from mucous membrane to mucous membrane. So, but you can't get it from, you know, sharing food or swimming pools or toilet seats. And I know people always worry about those. So it really is a sexually transmitted disease. And like I said, the vast majority of people never get symptoms from their HPV virus infection, and it's usually very transient. But if it persists, that's really where we run into trouble with cancers and precancers and anogenital warts.
Perfect, thank you. Any other questions? That's the last one that I have in the chat box. Anybody brave enough to come off mute and ask a question, or any last minute questions that you want to type into the chat box for us?
I just had a comment. I just wanted to thank Dr. Bakhru for your time today to discuss this very important topic. It's a little uncomfortable at times to speak on things like this, but it's definitely important. So I just thank you for coming onto this space and this platform to discuss this more, and I'm sure we'll get some more views a little bit later on. So thank you so much.
Thank you.
All right, well, thank you all for joining us today for the webinar. Like I mentioned, we can send out some additional resources to you guys so that you have kind of a snapshot of what was sent today through the webinar. And we hope that you will tune in for our next webinar for August. Our topic next month is going to be nutrition and healthy living, exercise, things like that. So stay tuned for some information on our next Arizona Health Chat. Dr. Bakhru, again, let me echo what Marina said. Thank you so much for joining us today and for sharing all that information, such an important topic with everyone. And thank you all for joining us, and we hope you enjoy the rest of your day. Thanks, guys.
Thank you.
Thanks.